Few things scare pregnant women faster than hearing your blood pressure is elevated. Suddenly, people start throwing around words like preeclampsia, induction, seizures, stroke, and women leave appointments terrified without fully understanding what's happening in their body. But here's the thing. Pregnancy naturally changes your cardiovascular system in huge ways. Blood pressure fluctuates throughout the day. It can temporarily rise due to stress, anxiety, pain, activity, or just being nervous about an appointment. There's a big difference between normal pregnancy blood pressure fluctuations, pregnancy hypertension, and preeclampsia. So, I want to break down what's normal, what's concerning, what symptoms actually matter, how providers evaluate these conditions, and some things women can do during pregnancy to support healthy blood pressure overall. My name is Jamie. I'm a midwife. I've been attending births for over a decade. Many pregnant women are surprised to learn that blood pressure actually drops in early and mid-pregnancy and returns back to baseline in the third trimester. A normal blood pressure is one that stays below 140/90. So what is the difference between gestational hypertension and preeclampsia? Gestational hypertension generally develops after 20 weeks gestation, without severe organ involvement that we see with preeclampsia. At this stage, providers are asking, is this relatively mild or is it becoming something more dangerous? So what actually makes preeclampsia different than hypertension, and why do providers take it so seriously? Preeclampsia is a disease process involving abnormal blood vessel function, inflammation, placental dysfunction, and stress on organs like the kidneys, liver, brain, and placenta. And what makes preeclampsia so tricky is some women feel completely normal until suddenly they don't. In addition to more frequent blood pressure monitoring, your provider may also want to assess your urine for protein as well as do additional blood draws to assess organ function. One of the hardest emotional parts of preeclampsia is many women still feel fine when providers are starting to discuss induction or early delivery. But unfortunately, because the placenta is part of the disease process, delivery is often the definitive treatment. It's a constant balancing act between giving the baby time to grow and preventing mom and baby from becoming critically ill. The goal is never to create fear or rush women unnecessarily. It's to recognize dangerous patterns before they become emergencies. Let's talk about how to support normal blood pressure during pregnancy. Now, I want to say this. Not all blood pressure issues in pregnancy are preventable, and developing preeclampsia is no one's fault. Preeclampsia is a complex placental and vascular condition, and some women with perfectly healthy lifestyles still develop it. But that being said, there absolutely are habits that support overall cardiovascular health that may reduce stress on the body during pregnancy. Dehydration can impact circulation and contribute to dizziness, headaches, and blood pressure fluctuations, so stay hydrated. Pregnancy dramatically increases the demands on the cardiovascular system and blood volume, so prioritize protein and balanced nutrition. Stress hormones can affect blood pressure and nervous system regulation, so finding ways to manage chronic stress and anxiety can help. Movement supports circulation, cardiovascular health, and overall pregnancy wellness, so incorporate gentle movement and exercise when appropriate, such as walking, yoga, or swimming. Poor sleep and exhaustion can often affect blood pressure regulation, so adequate rest and sleep are important. Look, attending prenatal appointments consistently is crucial. That way, changes can be caught early before they become more severe. Monitor symptoms seriously. Persistent headaches, vision changes, upper abdominal pain, sudden swelling, or feeling generally unwell deserve evaluation. I never want a woman blaming themselves if they develop gestational hypertension or preeclampsia. Sometimes these conditions happen despite doing everything right. Most headaches in pregnancy are not preeclampsia. Most swelling is not an issue. And one mildly elevated blood pressure reading does not mean something catastrophic is about to happen. But persistent symptoms, severe symptoms, or suddenly feeling off is worth getting evaluated. You are never dramatic for getting checked out. Did you experience gestational hypertension or preeclampsia? What symptoms did you notice first? Or were you completely surprised by the diagnosis? Share your experience below. Your story may help other moms not feel so alone.